YourMeds is all about helping people take the right medication at the right time with support of their networking, family and friends. By helping people become more adherent with their medication, you effectively improve their health outcomes, which helps increase their independence and their life choices. What we find is that working with adult social care teams across the UK, we also help increase capacity and reduce costs within the system. So when you fall ill, the first thing that the NHS will do is diagnose and investigate your symptoms. Once you've got that diagnosis, the GP will issue you with the prescription that you hope will either cure or manage your condition. According to the NHS and World Health Organization, only 50% of all medication is taken as intended. In the UK, we spent £9.6 billion on prescription drugs in the community. And the NHS, through the New Medicine Service, widely recognises that increasing adherence just to 80% just across 5 diseases like type 2 diabetes, high cholesterol, hypertension, would actually save the NHS £500 million every year. But the true cost of poor medication adherence in the community is actually felt within social care. West Lothian Council identified that one 15-minute visit, daily visit, costs the council £8,400 a year. So by helping people become more independent with taking their own medication and putting them back in charge, you can actually negate those visits. You can't negate all of them because some of them will be associated with personal care visits, but if people are taking up to 4 rounds of meds a day, there's the middle 2 that can definitely be taken out. So that allows the council care teams to actually increase capacity within the system. West Lothian Council found that they saw a 9 times return on investment, but importantly, it allows them to use the data that our system collects to inform that decision making. And what West Lothian Council do is that daily task of taking your medication every day, they use as a cognitive assessment tool. So what affects adherence? There are lots of things that affect adherence, and I'm not claiming we can fix them all because quite a lot of them are system issues, things like religious and social factors and poverty and financial hardships. But what we've made sure when we developed YourMeds was that people with poor technological literacy can actually use YourMeds. It's really simple and easy to use at the point of the user. In fact, we've just started supporting a user in Manchester who is illiterate. So he has someone going in to support him with opening up his mail and reading his mail to him. But for the first time, he can actually self-administer his own medication through our technology. We've also ensured that if you've got technology poverty, that we can support you with that. So we ensured that there was a mobile SIM already built into the system. So you don't need Wi-Fi and broadband to be able to access our system. And why does every dose matter? Well, when drugs are developed and the drug companies spend millions of pounds trying to develop these drugs, they ensure that people take their medication at the right time. To basically show that the efficacy of the medication works. And especially in conditions like Parkinson's, epilepsy, migraines, MS, and all the ones that are listed here, it's really important that people take their medication at the right time, at the right intervals. So the value proposition around YourMeds really addresses the growing and ageing population. Our technology supports patients and carers to supported self-management, and 15 million people in the UK actually have a long-term health condition. Someone over the age of 80 has a 1 in 2 chance of falling. The annual cost of falls is £4.4 billion. 1.1 billion of that is felt in social care, and 2 billion is actually felt just by hip fractures account for 2.2 billion of that sum. When YourMeds started its journey, actually, we developed the first colour-coded mar charts, and our first part of our business is actually focused within the care home side. And from our care home database, we know that we've got about 50,000 people on our care home database, that 1 in 6 of them will take a drug like warfarin, dioxin or codeine, which can cause drowsiness and may make people fall. Councils and organisations spend millions of pounds trying to put in sensors and try and anticipate when people are going to fall, and a lot of money goes into preventing people to fall, but actually nobody looks at the medication piece. So how do you know that someone hasn't fallen because they took their nighttime meds in the morning? And really we think that integrating that medication data is really a crucial part of that jigsaw to understand how to improve a user's outcomes. Another area where we feel that YourMeds can really support people is with carer fatigue. We've got a programme happening in Manchester at the moment with Parkinson's. I'm going to talk a little bit more about that later on, but actually the way our system works means that the carer fatigue on that primary carer can be reduced by using YourMeds. So what is our system? Well, YourMeds, this is it in its actual physical form, very similar to an advent calendar. You see a number on the tag and then you open up the corresponding number on the box when it's time to take your medication. The packs are filled and dispensed by the pharmacy, and like I said, you've got a SIM in there that basically connects to the strongest signal in the property, so it's not attached to a certain provider, it will just pick up the strongest signal, and that signal could change across the day. So in the morning it could be EE and in the afternoon it could be Vodafone. The second part of the system is the supporter app. So a user can nominate up to 5 people from their support network to support them to become more adherent. 10 minutes after the initial alarm, the first supporter is informed, and on the supporter app, which is available on Google and Android, the supporters can see what medication was due yesterday, what's due today, and what's due tomorrow. The third part of our system is the dashboard. So here we can log every single medication round, so we know what time it was taken, if it was taken late, early, if it was missed, if the wrong ones have been taken, if multiple wrongs have been taken. And we can also see every single supporter notification. So it gives you a full audit trail of all the medication and everything around that. Our technology is also insured by Lloyd's of London. So if you've got carers who are working within the system who aren't insured to provide medication support, they can do effectively with the YourMed system. Like I said, we love data. We're all about data. So we crunched some data and we found that on average, our adherence rate is 84.4%. During the lockdown period, when people were a lot more unsupported, the adherence went down slightly to 82.2, but it's still well over the 80% that the NHS is trying to achieve. Our male users are slightly more adherent than our female users, and actually our older cohort, our over 79-year-olds, are actually the most adherent at 90.5%. What we also found was that 1 in 4 of our rounds is adherent due to a supporter nudge, and the supporter nudge is really the crucial part of our YourMed system. So we know that everyone needs a little bit of help every now and then to help them achieve their goals, and YourMed provides a really effective way for you to achieve that. A big question I often get asked is pharmacies. So how do we onboard our pharmacies? Well, over the last 15 months, we've recruited over 250 pharmacy partners across the UK, and the way we've recruited them is by working with the various councils that we work with. We will look at that area and then onboard the local independent pharmacies. YourMeds fits within that pharmacy workflow, so it's very similar to the community packs and standard dossier boxes that are issued, and there's about 1.5 million of those issued every week in England. So because it works within that pharmacy workflow, it takes maybe another 30 seconds really to apply the seal on the YourMed system. So it's, it works well within that workflow, so pharmacies don't have a pushback against it. It's also scalable, so we've made sure that our technology can integrate into the pharmacy robots that more and more larger pharmacies are using. Within the UK, we work with 9 organisations at the moment, and there's probably another 5 to 10 that are due to start imminently. Wigan's a new council that we've just started working with, so we're working with their care providers, and that's again to increase capacity within the system, because they've recognised that there's a huge adult social care staffing issue, and actually if they can help their care providers work more effectively and smarter, then they're going to support them to do that. Just quickly about the Parkinson's programme that we've got running in Manchester. I'm sorry, this is really small. Hopefully we can just send you the slides so you can have a look at it. So this logic model was created with Wessex AHSN, and we worked with Parkinson's nurses in Manchester to identify users who are using their service but are also struggling with their medication adherence. Some of those users are up to 10 rounds a day. And what we hope to see from the pilot that we ran was an improvement in adherence, a reduction in primary and secondary care demand, a reduction in care fatigue, and also to increase the independence of the patients to delay more expensive care costs. the initial feedback is that on average our adherence rate is 87% with our Parkinson's cohort. Users have experienced greater independence. 40% of the users have been discharged from the service, and we can't say it's all due to YourMeds. A number of factors are involved in that, but actually by people becoming more adherent, that was one of the factors why they were discharged from the service. I'm loving some of these statements. So it lets my wife rest as I can remember when to take my own medication, and YourMeds has saved my life. It's given me my life back. I was all over the place before. So, and you know, getting those sort of feedback is the reason I work in digital healthcare, because I just think that if a simple piece of technology can change a person's outcomes, then I'm all for it, and that's why I want to get involved with this. Working with councils, we support people with long-term health conditions. So we've seen the daily challenges that reablement teams face, especially managing hospital discharge and supporting service users with their medication in their own home. West Lothian Council saw a 9x return on investment, saving £3,376 per user. We did a pilot in Leeds a while ago, which showed that by extending a user's time in their own home by 88 days, the council actually saved £7,190. This is kind of a workflow that we would like in our utopian position. So we'd love our data to be integrated into the primary, into sort of GP records, so that when you go and see the GP, he can look at your adherence record and say, actually, the reason that your blood pressure tablets aren't working is because you've not taken them. And you know, it could provide a whole system-wide benefit from primary through to secondary care, reduce fewer hospital admissions, and a reduced demand in primary care. The joining up of health and social care through the ICSs is also a really exciting time, I'm hoping. And along with the white paper, putting people at the heart of care, it provides an opportunity to create a system that uses digital technology to bring medication management into the 21st century. What I'm looking for is really people who are open to look at this medication management piece, which I think has effectively been ignored for like forever. There's no responsibility as to who is in charge of the medication once it's given to the user. We assume that the user will take it, but we know that that's not what happens. So it'd be great to bring a piece of digital technology into the system and to change the way medication is managed in the community for the 21st century. Stop presenting.
Is that the 28th thing? Oh, that's the same way. Okay.
That was great, Pretty. Thanks for your overview and some interesting stats and also feedback there. So thanks for that presentation. You covered off the projects that you're actively involved with at the moment. So yeah, quite a wide range of projects. What are your ambitions for the Yorkshire and Humber region? What's the sort of ask within that region?
So we've started a discussion with Leeds Council and Calderdale and Kirklees, and I think they're all trying to join up to do a larger scale sort of implementation, and because they're all fairly close to each other. So I'd love to see something really within the ICS footprint, something on a larger scale that we could push out. One of the things that we are lacking at the moment is the evidence. I mean, we've got user outcomes and we've got evidence and we're working with various councils to try and pull together this evidence, but really to have a larger scale programme and to really build that evidence to sort of say, yes, this works, let's go for it, let's push this out. Yeah, so.
Okay, and how can people contact you for any follow-up conversations?
You can happily stalk me on LinkedIn. I'm all over that, and hopefully you share the slides because they were quite tiny, and my contact details are at the end of that slide. But yeah, and just pick up the phone and give us a call. Happy to do a Teams meeting and talk about what the issues are within the system. I'd love to have a wider discussion with people about medication and how it works within hospital discharge and how it works within the community. Because I think the NHS and social care do kind of butt heads around the medication piece, and we know that a lot of our conversations with social care get stonewalled when it goes towards the NHS, but I'm hoping that this whole joining up of health and social care will enable those conversations to flow more easily.
Yeah.